welcome back. And still talking about initiatives done by the President and the government. We're going to be talking about the Decent Life Initiative launched by the President in 2019, aiming to provide a decent life to the most vulnerable groups nationwide. It further contributes to enhancing the quality of daily public services provided to citizens with an eye on inhabitants of rural areas. The initiative also provides healthcare, medical services, surgeries, prosthetic devices to these groups. And it also aims to develop Egypt's poorest villages according to the poverty map, providing job opportunities and support to orphan girls so that they can get married. We're joined right now over the phone by Dr. Mona Araishi, a women empowerment advocate. Good evening to you, ma'am.
Good evening.
Thank you for joining us.
Thank you.
Can you tell us a bit about the Decent Life Initiative and how it's empowered, the more vulnerable people within society?
Yeah, of course, the most vulnerable people within the society are the children and the women.
Yes.
I believe that empowering those two population sectors will really bring an added value to the Egyptian community as a whole, because this is where everything starts. Of course, the women are even before the children, because they are the ones that are taking care of their children, accordingly bringing them to the level where they are contributors and influencers will affect the siblings, and even if I mean, like for example, the orphans. This will even affect the dimension of the social community at large, because when people are empowered and aware, there will be less negative impact on the community.
Yes.
And by empowering, it's not just the dimension of the financial dimension, but also I believe bringing the awareness of, let me say, understanding themselves, being able to provide for themselves, knowing their strengths, coping with the stress and becoming resilient. This is, I believe, where any investment will help give a great push to the community through the women, and then eventually through the whole family, and then eventually through the whole community in the villages, and then of course for our beloved Egypt as well.
Yes, and the fact that this initiative doesn't just involve, like you said, financial aspects where they, obviously this is important, creating infrastructure and creating proper housing and decent life for people living in villages and around Egypt. The fact that they're also introducing things like medical services and surgeries, in addition to helping people with like orphans and all of that. How do you think this affects the people living in the most poorest of places in Egypt? Yeah,
we all know that the person is a body, a mind, a heart, and a soul, right?
Yes. Yes.
So whichever investment in any of those dimensions is placed, then you will feel an effect. So what I was mentioning now is related basically to training and education.
Yes.
In addition to the dimension of the healthcare.
Yes.
And you know what? It's not just the healthcare aspect that brings the health in a better situation, but also feeling cared for. Because this is something that I believe in an emotional, psychological manner would be very effective. Because the people will understand their value. I'm not just anybody. I am being taken care of. I have specific services that addresses my needs wherever I am, whomever I am. And in this itself, you are building the character and bringing in a lot of confidence and, let me say, motivation to improve yourself.
Yes. And it was interesting as well. I mean, this might not be related to a Decent Life Initiative, but the Ministry of Health itself has launched several campaigns targeting women's health, which is very important. Do you think that before these campaigns took place, that women's health was ignored by the people themselves, and they didn't go and get checkups?
Yes, of course, the awareness. I have seen many cars everywhere, the buses everywhere, all over the place. And people were talking about it, among each other. And the power of spreading the word. The people talk among themselves, and especially ladies. So when the ladies among themselves are able to advocate this health improvement dimension, it will definitely reflect not only on their own health, as I mentioned, because they are the mothers. whenever the mother is stronger and she is in a healthier situation, she will be able to take care of her children in a better way and even raise
Yes.
healthier infants and siblings in the future. So
Yes.
it starts from yourself.
Do you think that this initiative benefits what sort of grouping specifically more than others?
So all the people who are not addressed in any other initiative are there,
Yes.
and the population that are most in need really are the children and the women.
Yes.
And on the contrary, there are the most people that we should be investing in, given that they are the infrastructure of the society.
Definitely.
This is the building blocks of going forward, and by making those sectors of the society
Yes.
more able, more healthier, more aware, let me say more educated, this is where the excellent value will come, and they are so much in need that even a small investment in those dimensions will bring a big difference
Definitely.
at the end of the day.
Do you think that this initiative will also help in creating jobs?
Of course, you see, it's a flow. You are now giving an injection of vitamins, of motivation, of understanding, of more being people who are really healthy, in not only on the dimension of their health, but in their mind.
Yes.
Definitely, more ideas will come. The initiative itself will generate jobs by definition, because whoever we are delivering a service, and service is a sector that is also highly, it uses people to deliver. But on the other hand, when the people are better, there will be a better understanding, and then the economy will roll out positively, as good as everything happening in the country today.
Okay, unfortunately we're running out of time, so Dr. Muna Araishi, Women Empowerment Advocate, thank you so much for joining us over the phone. And this brings us to the end of this episode of Cairo Local Time, but stay tuned for more updates on Nile TV.